Hi, in this video we'd like to go over the mechanism of treatment for hyperemesis gravidarum offered by Antai Hospital and why our treatment is so effective. So Antai Hospital is offering a HG vaccine, also known as our HCG desensitizer for our patients suffering from hyperemesis. And this treatment is highly effective. And you can ask all of our previous patients. The results will speak for itself. So we recommend our patients who see this video or those who have hyperemesis, survivors or first-timers, please seek treatment first so that you don't need to suffer during pregnancy. Now in today's video, I'd like to simply break down the mechanism of why it's so effective, how it's so remarkably helps you recover from hyperemesis, and if you've taken it in the right time, you may even completely eliminate it from your pregnancy. We can guarantee this up to a 95% success rate. For hyperemesis gravidarum, we have identified that it is closely related to the presence of pregnancy hormone HCG. So during pregnancy only is this hormone present within your body, and during other times it's almost never present in your body unless externally introduced, which is unlikely in any case. So HCG is a double chain protein chain built up from several amino acids. There's an alpha chain and a beta chain, alpha subunit and beta subunit. And it's specific to a few receptors in the body during pregnancy. Now, today I'd like to mention H1 and H2 receptors. Now, H1 is a receptor that will bind with free-flowing HCG during pregnancy, and it's situated in the ovaries on the corpus luteum. So H1 is only found in corpus luteum, and when HCG binds with it, it will actually promote maturation, development of the corpus luteum, make it grow better, and the corpus luteum will secrete more progesterone, which is more optimal for the pregnancy. And this is very important for the support and sustenance of the pregnancy until full term. So the next part is that I like to talk about H2 receptor. Now H2 receptor is a receptor that is found in different places, that is not in the ovaries or the reproductive system. It's commonly found in the centers that regulate sleep, regulate nausea, vomiting, mental activity, in places that secrete mucus, which includes several glands. For example, the salivary glands is another prominent place as well, and also in the stomach, the gastric glands as well, because they secrete stomach acid. All of these places and more have a lot of these H2 receptors. Now these H2 receptors is present in all women, but the only difference is the amount that is present. So for women who do not suffer from hyperemesis, which is the large majority, they may have very little H2 receptors that are present in the body. That is why they don't see any significant reaction with the presence of HCG introduced in their body during pregnancy. They may only experience a little bit vomiting, a little bit change in appetite, and other responses that we can link to morning sickness, very mild and healthy and normal. It's considered a very common symptom of pregnancy. However, there's a small group of women who have abnormally high amounts of this H2 receptor. This is abnormal because H2 receptors are not supposed to be abundant, but these women, they have several hundred times the amount of H2 receptors in their system, which is why when HCG is introduced into their bloodstream during pregnancy, secreted by the pregnancy, when they bind with these H2 receptors, then they experience a phenomenon known as central sensitization, where all the glands, all the organs related that have these H2 receptors are being fired constantly, which is why they're experiencing the constant vomiting, the constant insomnia, nausea. They may even vomit blood, which is another common symptom, and excessive salivation because the glands are being fired non-stop. It's a torturous experience and only will stop when HCG is slowly dropping towards the end of the pregnancy. So it means that it will last throughout the entire pregnancy, starting the early weeks all the way until 9 months of pregnancy. Now this is incredibly difficult, which is why Antai Hospital is now offering this treatment. And as to why it's so effective is that because we've clearly identified that these receptors are linked with Hg, our treatment simply works by blocking this H2 receptor. Now, you may think that when we block these H2 receptors, won't H1 receptors be blocked as well? But H1 receptors are situated in the ovaries within the corpus luteum, which is why it will not affect the treatment process. Furthermore, H1 receptors are very highly vital in the process of securing this pregnancy, keeping the pregnancy healthy and for full term as well. Just this simple concept can allow us to achieve a full elimination of hyperemesis from your pregnancy, giving you a smooth, healthy, without any stress or trauma. And this is something that you do deserve, and now it can be achieved with our Hg vaccine that we are offering to all patients who are seeking it. So we do hope that you've learned something in this video, that I've explained clear enough. If it's not clear enough, please leave me some feedback down below. And this treatment is definitely something worth considering, worth trying, because it can definitely achieve wonders towards your next pregnancy without any hyperemesis disturbance. Now, if you'd like to seek this treatment or consultation with our doctors, please visit our website at www.antaihospitals.com, set up a consultation so that we can actually explain more in detail and make some arrangements for you to receive this treatment today.